I'm Dr. Nisal Gange. I'm a geriatrician and a stroke specialist. And over the last 8 years, I've been the director of Geriatric Adult Rehabilitation and Stroke Services here in Toombar.
My name's Dr. Anna Taylor and I'm a geriatrician here at Toombar Hospital. I just finished my training in February 2020, so this is my first year of being a consultant physician and geriatrician. The things I love about geriatric medicine are that older people are interesting and they are very complicated, generally speaking. And you really need to take a specialised approach in being able to assist them in a person-centred way through the hospital or in the community. And that really suited my own personality and my own interests as well. Really enjoy being able to look at the whole person and take a holistic approach to their medical and psychological and biological and other issues, and trying to figure out how to help them the best way we can and to optimise their function and independence to live the lives they want to. I think we offer a great breadth of patients' problems and experiences here at Toombar. There's a great team. A smaller hospital is usually what you'll find in a regional area, and I think the smaller the hospital, the easier it is to get to know people, to make links across disciplines, and to make getting great care for your patients easy to achieve because you know the people involved. I think also you develop great relationships with your colleagues at a registrar level and now as a consultant, that as a smaller hospital you really all need to kind of work together to get the best you can for the patients and for the community.
You have a smaller number of staff and colleagues available, and you become a family quite easily. For instance, in stroke services, if I have a patient in the emergency department, I can walk to the MRI room and get a scan done within a couple of minutes. Whereas in a tertiary center, you might struggle to do that because the departments are so vast and busy that you might not be able to do that. So you are able to talk to each other, your colleagues, and get the best care for your patients as well.
To enter into geriatric medicine training and to become a consultant in geriatric medicine, you must undergo a 6-year training pathway through the Royal Australasian College of Physicians. Fellowship is a 6-year full-time training pathway consisting of 3 years full-time basic training in adult internal medicine, followed by 3 years full-time advanced training in geriatric medicine. Adult internal medicine basic training consists of 2 years full-time core training, including 3 months general and acute care medicine and 12 months in medical specialties. A maximum 1 year non-core training. Completing basic training in adult internal medicine allows doctors to train in general and acute care medicine and/or specialise in one of 26 medical specialties available in the advanced training program. Advanced training in geriatric medicine comprises 2 years of core training and 1 year of non-core training to complete 3 years of training altogether. The entry requirements into specialty training in geriatric medicine include general medical registration with the Medical Board of Australia, being a citizen of Australia or New Zealand or a permanent resident of Australia, having completed the RACP basic physician training, including the RACP written and clinical examinations, have an appointment to an appropriate advanced training position. For basic trainee positions, the first year of basic training is usually managed by the hospital and health services involved, not via the network or through the RACP. For the second and subsequent years of training, trainees can apply to be part of a network of training positions, which is centrally organised and recruited through the RACP and organised so that trainees can rotate through particular specialties required to help prepare them for the written and clinical examinations. For specialty training in geriatric medicine, positions are organised and recruited through the Queensland Geriatric Medicine training pathway. This is usually an interview process for new and continuing trainees, and all new and continuing trainees must apply each year to progress through the training pathway, and this is administered through the RMO campaign. The Geriatric Medicine Advanced Training Pathway offers a centralised and coordinated recruitment process for all advanced trainees progressing through geriatric medicine, emphasising consistency and quality in association with trainee equity, flexibility and choice. Once you have secured an advanced training position, you must apply for prospective approval as per the RACP progression through training policy.
The geriatric medicine at the moment is a competitive field, and it is going to be, I anticipate that this would be even more competitive in years to come. Having said that, we need more geriatricians because the Australian population as a whole is aging, and we need more skilled workforce to counteract and face that challenge.
The tips I would give for someone thinking about physician training and advanced training in particular would be to give yourself time to gain experience as a senior resident and then as a junior registrar working through your basic training years. I think a lot of people try and rush through them, and it's perfectly okay to take your time, gain experience, particularly as you're working out what you're interested in. And if you do find that you're interested in geriatric medicine, seeking out experiences in those fields, such as the memory clinics, falls clinic, movement disorder clinic if you have access to it, and then any terms in rehab or acute geriatric medicine would all give you good experience in figuring out that that is what you want to do, and then we'll help you with your application. There are a number of advantages living rurally or regionally. I think the commute is usually much shorter than most places you would live in versus where you'd work out in a metropolitan centre. House prices are very much more attractive, and you can get a lot more bang for your buck, so to speak, as to where you live. The climate is a very cool subtropical climate, so we get 4 seasons in the year. We get proper winters and much cooler, dry summers, which suits me personally. I think Toombar also has all of the amenities that you would need. There's a lot of schools in Toombar. It's an education centre for the district, so there's any kind of school you could think of really here. And I think the people in a regional area are really grateful for being able to access specialty care in their own communities as well. So I think the community is a big part of why it's very rewarding to work in an area like Toombar. Particularly as well, there's a lot of people living in rural areas that we service. The Darling Downs Health Hospital District is very large, and we service a lot of smaller facilities that rely on the specialty services available in Toombar to help manage more complicated medical issues in their communities, and we can certainly achieve that. I've lived and worked in a few other places around Brisbane and elsewhere, and certainly I would choose Toombar over all of those places again if I had to.